Here are some things that you can do so that you feel a part of, so that you feel like you're participating, so that you feel like you're able to help fix in some way, that you're really making things the most positive that you possibly can. Welcome back, and if you are new to my channel, my name is Ashley Osier and I'm the posture specialist. One of the best ways that you can help the chronic pain sufferer is to prevent injury to yourself. Now in this next slide, you're going to see that there are non-professional and professional caregivers. Both report musculoskeletal pain in at least one body part. More than half report back pain. Almost half report knee, shoulder, or wrist pain. More than half report that the pain impacts their ability to provide the complete care needed to be a caregiver, and more than half report pain having a negative impact to their overall quality of life. Now, the difference between professional caregivers, who are nurses in hospitals, and professional home health nurses, and non-professional caregivers is that professional caregivers have access to both training and technology to help reduce injury risk. So especially if you are a non-professional caregiver, I want you to take everything that I say in this video seriously. Check out all the links so that you can empower yourself to reduce injury risk yourself and provide the most optimal, lasting care for your loved one as possible. So you want to be a part of the wellness team. And the wellness team isn't a one-man or one-woman show. A wellness team comprises of a number of different people that are going to effectively be able to provide good health care, recovery care, rehab care, and then post-rehab care for the person that you care about, your caretaking, that is your spouse or your child or your parent, whatever that is. So it is not a one-person show. The wellness team is a number of people. Find different players who are going to participate in the most optimal way to help that chronic pain sufferer make that progress. It's just a matter of figuring out what needs to be done, who needs to be a part of that team, and how you can participate in a way that uses your skills, your gifts, the things that you're really good at, and making that all just happen. What if the chronic pain sufferer says,
No, I don't want you to be a part of the team. You are not a team player, and so therefore you cannot be a part of the team.
That may happen. And if it does, I want to encourage you to be patient. The chronic pain sufferer may be feeling sorry for themselves. They may be, having a difficult time. They might feel guilty that you even have to do anything for them. They don't want you to have to do any more for them than is absolutely possible. So there may be some guilt. There may be some shame. So be patient. Use it as an opportunity to build up your wellness savings account, okay? We want to be putting that good stuff into your savings account so that when you're really needed, that you are giving from your overflow and not from your emptiness. What else can you do? Love more, care more deeply, communicate more effectively, be more protective, speak up for the chronic pain sufferer. Make sure that those doctors that might not really care, even though there are tons of doctors that care, but make sure that those doctors understand that it's not all in their head, that they're not faking it, that they really do need extra support, or they need that test, or they need that MRI, or they need whatever that is, the physical therapy or the aqua therapy, whatever that is. Be their best advocate. Another way that you can help is to make sure that you don't run away. Make sure that you are working on your communication. Do you know what you're going to feel? Do you know what it's like to be somebody who constantly is bombarded by another person
who is complaining, who can't ever get better, who is always in pain, who never has any relief, who tries to get you to help them, but there is nothing that you can do that relieves any of their symptoms whatsoever, and apparently nobody else as well, and you can't do anything right.
The chronic pain sufferer is likely going to really frustrate you. They're going to be discontented. They are going to be impatient. They're going to be full of fear. They're going to be full of frustration and anger themselves. They're not going to want to have to deal with their own issues. They're not going to want to have to calm down. They're not going to want to have to not be afraid, because it's their body and their life that is being impacted and being changed in their mind forever, and not necessarily yours, even though they don't realize that since you're in the boat with them, even though you don't have the physical pain, you are still along for the ride. That's going to be the next video for the chronic pain sufferer. You'll want to stick around for that one. How are you going to feel? Well, you're going to be angry. You're going to be frustrated. You're going to feel helpless and hopeless. You're going to be afraid. You might feel ashamed or guilty that you don't know. You don't know who to talk to. You don't know who to ask. You don't know what to ask. You don't know how to go about doing things. You may feel at the end of your rope. You may feel like you just can't be there anymore. And those are going to be normal feelings. It is very difficult and complicated. Now, I don't want you holding your frustration in. I don't want you holding on to it, and I don't want you holding it in. Because what's going to happen is you're going to be clenching your jaw, grinding your teeth, your shoulders are going to be raised, your eyebrows are going to be furrowed, and you're going to be smiling. Shake it out. Do what you need to just shake it out, so that you are keeping yourself free from tension and frustration as much as possible. I would challenge you to really make sure that you are reaching out to somebody who can support you, who understands. If you are going to overextend yourself, make sure that it is a short period of time. Plan a timeline and stick to it. Okay, make sure that you're realistic about it. Be specific about your timeline. Make sure to take the breaks that you need to take care of yourself. When you are doing the things that you need to do to take care of yourself, I want to encourage you to communicate well. I want you to sandwich what you need to do in the middle with how much you care about and how much you're going to stay and not leave the person who is suffering in chronic pain. So, for example, I am here for you. You're important. I believe you. And I need to do these things to take care of myself, or I need to go and get a massage right now, or I need to go and take a walk, or I need to go to the gym, or I need to get, just have some quiet time. But I'm going to be back. Or call me or text me if you need anything. If I can't get to the phone, I will get to it as soon as I possibly can. I will answer you as soon as I possibly can. Don't worry, I'm here and I'm not going anywhere. That kind of language is just an example of how you can sandwich, making sure that you take care of yourself, but you're also letting that person know this is the reality Don't worry, I'm here, I'm going to be available, but I need to do these things as well. If this is someone who you are physically caring for, and it is risking safety for your physical body, and you need somebody else to step in to help you or to take over, I want to give you permission to make that happen and to make that transition. It doesn't mean that you have to leave and bail and abandon and escape. It just means that you need help, and that you need to make sure that you are not putting your physical body in jeopardy. Now, as a body worker and somebody who helps people who've had injuries and to help rehab and to become more functional, and I've been doing this work for over 20 years, I get to feel what people's body feels like when they have put themselves in a situation that is physically not safe for them. I'm just talking about injury-wise. And I want to encourage you and give you permission and let you know that I would never encourage any of my clients, any of my students, or my family members, friends to put themselves in harm's way. So if there is somebody who has a physical condition that is outside of your scope and your ability, your physical ability, and you need to have a part of that whole wellness team is to have somebody come in and assist, have somebody come in and take over, then I really want to encourage you to do that. So know that you can help, but you are not the healer. You are not the doctor. You are not the physical therapist. You're not the rehab specialist. You're not the corrective exercise specialist. You are just the person who cares for, loves, or caretakes the person who has the chronic pain. I will be doing a video for the chronic pain sufferer and their responsibility, which they do have, and they have to own their part based upon their circumstances. Make sure to check out the videos that I have around my person here that I think will be useful for you and or the chronic pain sufferer in your life. And I will see you in one of those videos.